today. We are traveling to Pennsylvania and meeting with Jacob.
I have had Lyme disease for that I've known about for probably 8 years or so. I was very tired a lot, so like chronic fatigue, dizziness. I kind of felt like this almost like disconnection from like I guess people will call it depersonalization or derealization. I had that going on. I would like to say that it's at least Dr. Dashore's protocol is very comprehensive. I can't even believe how much better it's gotten.
Hello, everyone. Welcome back to the BioNexus Health Podcast series. We will be speaking about Lyme disease and recovery from Lyme disease today. We are traveling to Pennsylvania and meeting with Jake. Jake came to me after several years of treating Lyme disease with the conventional methodology. Jake is very well researched in the subject, and he had been trying to get better. He saw some improvements, but he wanted to transition to a completely natural herbal protocol and give that a try to see if he could achieve the health goals he had for himself. You know, someone so young should be full of energy and vitality. And that was something that Jake was looking to achieve, a little bit more energy, being able to do activities, exercise, to just, achieve a full life again. So let's go ahead and welcome Jake to today's podcast.
Welcome to the BioNexus Health Podcast with Dr. Jodi A, Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodi A, Dashore.
Hi, Jake. How you doing? How is Pennsylvania today?
Hey, doctor. It's good. It's really nice out. It's Saturday. Beautiful weather in Pennsylvania. I can't complain.
Oh, good. Well, speaking about complaint, can you tell us a little bit about your journey with Lyme disease and how did you decide to go completely herbal?
Yeah, so I have had Lyme disease for that I've known about for probably 8 years or so.
Oh,
Uh,
goodness. Okay.
yeah, that's when it kind of got out of hand, and I realized I had to do something. So I took antibiotics altogether, probably several years. I would pause, go back, take breaks, whatever. But eventually, that didn't have like a very it wasn't agreeing with me. You know
It
what I mean?
wasn't agreeing with you. You know what? We had a little bit of a glitch with your internet. So just to reiterate, you said that you took antibiotics off and on for 7 years.
No, several years.
Oh,
Sorry,
several years. Several
several
years. Go ahead.
years. And, that's when I started learning about the antimicrobial herbs that were beneficial. Um, and I kind of phased out antibiotics and started replacing it with those, but basing it mostly on my own research. I didn't have like a doctor to guide me or tell me which things I should be taking and when. I was just uh, I was reading books, finding stuff on the internet, which was helpful, but I needed more than that.
Okay. When you came to me, what symptoms were you experiencing? You wanted to transition to a structured herbal protocol with guidance. So when we first started, what symptoms were you experiencing?
Oh man, I was very tired a lot. So like chronic fatigue, dizziness. I kind of felt like this almost like disconnection from like I guess people will call it depersonalization or derealization. I had that going on. And then I had a lot of like anxiety from like seemingly nothing. Like I had no reason to be anxious, but I was just like always very anxious and a little bit of depression at the time too. So those were my main symptoms.
Okay. What about your cognitive symptoms? Any brain fog, any issues with memory, remembering?
Yeah, that's been going on for so long that I have almost forgotten what it was like to not deal with it. So yeah, I kind of forgot about it. But yeah, brain fog, trouble finding names, remembering people's names. Same with like words that were, not like a difficult word to remember or anything. Something like right there I couldn't remember the name of. Just like a mental sluggishness that I couldn't shake no matter how much like rest I got or how much coffee I drank or anything like that.
Oh, right, right. How about your digestive system?
It was it was also not the best, and uh, that's probably from taking so many antibiotics, but also,
Right,
of course, the illnesses themselves.
right. That's true. Okay. Then we started with you. We did some additional labs, and you have been on a very comprehensive protocol for a little while. What improvements have you seen with being on a fully herbal protocol?
Hello?
Oh, I can hear you.
Okay, sorry. Yeah, I guess my connection's not the best. Um, you, I heard you say what improvements seen.
Yes, is it possible to go a little bit closer to your router, maybe? Would that help?
Yes, hold on, give me one.
Okay, sure.
Could try that.
Yeah, it's getting better already. It's going from red to a little bit better, your connection.
Okay, how's that?
Good. Right now it's not red, so that's good. Yes. So what I asked you, Jake, was what improvements did you see once we started? First, we did labs for you. We got some additional information. And then we started you on a fully customized herbal protocol for you. So how have you been doing? The protocol is comprehensive. What benefits have you seen so far?
Well, nearly all my symptoms have improved. I would say a lot of that has been the mental clarity and the brain fog and all that. Like it's getting better all the time. Um, I had a little bit of a flare a little while ago, and it like kind of reminded me like just how bad it used to be.
Hmm.
So that's doing a lot better. Of course, I can find and remember people's names. Words are easy to remember. Just like thinking is much smoother. Everything's kind of like more clear, and my cognition has just improved overall, as well as my energy. That's a big one too.
Okay. So are you exercising a bit more, a lot more?
Oh, yeah. My exercise tolerance is like I can't even believe how much better it's gotten. I actually kind of like started exercising too much, and I know that sounds like crazy to a lot of people, but like that's one of the things that's really helped me throughout this, and that's what makes me happy. So I would, do that and found it really helped, and I was really able to like crank that up a lot.
That is good. Has your digestion improved? How about your gut? You've seen benefits with your gut. What about aches and pains?
Yeah, the aches and pains. I don't really get them anymore. I'm not dealing with anything like that.
Fantastic.
So yeah, that's awesome. I know the lab work we did for the gut microbiome and everything, it was not that good when I first came to you. And so we just went over recent labs for that the other day, which showed a great improvement. So that's been going really well too.
It's always good to see the improvements in labs. Sometimes when your symptoms improve, it is an added reassurance that your body is also getting better. So it's kind of important to do labs at least once a year, if not more.
Yeah, I would agree. And those are it's really helpful to see. I mean, I feel better, but it's like nice to see that on paper, you know what I mean?
Yes.
So yeah, that's good.
Yes. See, some of the things you've mentioned to me with your energy levels, with your mental clarity, aches and pains, you said you haven't felt this good in years.
Yeah, it's true. I've been having a really rough time, and especially during COVID and everything,
Yes.
that was tough for me, but I'm feeling great now. I'm very happy.
Yeah. Me too. It is when you came to me, you're someone so young. And to see you debilitated in the way that you were, in spite of trying so hard, so many rounds of treatments, and you hadn't achieved what you wanted to achieve. So I'm really happy to see that you've gained so much ground with your health.
Yeah, it's it's a good feeling, and I'd also say like I wasn't being treated adequately for several different infections that no other doctors seemed to be able to find, but that showed up in the lab work we did. So that was pretty important.
Oh, yes, absolutely. All co-infections have to be identified and treated in order for significant and lasting progress to be made in a patient with Lyme disease, chronic Lyme disease, so that you don't end up with, what they call as post-Lyme syndrome.
Mhm.
So that I don't anticipate that for you.
No, me neither, hopefully.
Wonderful. Good, good, good. So, what would you like to say to people watching about herbal medicine for Lyme disease?
So I would like to say that it's at least Dr. Dashore's protocol is very comprehensive. Herbal medicine is very helpful. It's gentle. I mean, you can definitely push very hard against some of these infections, but you can also control your dosing, right? So you can go at a pace that's slow and that's really gentle on you. I know sometimes when I would take antibiotics that only come in like one or two strengths, you take something and you can get really, really sick from like a horrible Herxheimer reaction that could last who knows how long. So, uh, that stuff used to take me out of commission all the time. And, just going with herbs and going slowly and as per my body's like tolerance, it's helped me a lot. I definitely recommend them.
Oh, there you're. It's all right. It's just a tiny glitch. So that's fine. People understand because um, you're sitting at your place and I'm mine. And Zoom is weird. I'll be fine on Zoom with a patient from the US all the way to Australia. And then somebody local, like New Jersey, New York, Pennsylvania, I'll start having glitches. It makes no sense.
It's too bad. You're okay?
Oh yeah, yeah, we're good now. We're good. Yes.
Okay.
So, well, it is really happy to hear, and I know it will be helpful for many of those watching to hear your inspirational recovery story. So I'm glad you made it here today to speak with me. So thank you for being here.
Absolutely. I think people need to hear this kind of information.
Yes, Lyme disease is affecting so many young people. You are in your very early 30s, and you've been dealing with this for so many years. So it's like, in your 20s where you should be out there enjoying life. It's just stolen so many wonderful years from you. So
Yeah, that's probably one of the most difficult parts of it. It was like these are supposed to be, the best years of my life, and I was just like sick the whole time, and had to say no to a lot of things that I would have liked to be a part of. And it's funny too because when I started getting sick, I was just like, I'm like, oh, I'm just getting old. Like this is what happens to people as they get old. But I was in my 20s, and I thought that. I really thought that. So it's good to finally, figure out what's going on and
yes.
change.
Yes, I mean, Jake, the change in your face, the level of vitality, the shine in your eyes that I see, right? Your skin and that smile, of course. I'm really happy. I'm glad you came here today, and I'll see you at your next appointment soon enough, I'm sure.
Yep. Yep.
All right, you take good care, and everyone watching, thank you for joining us. Remember to subscribe to the channel, right? Because I think we have about 52% of people that are watching the channel are not yet subscribed. So do subscribe, help us spread the word, and I'll see everyone at our next BioNexus Health Podcast. Until then, be well, keep smiling, and namaste.
Thank you for joining Master Herbalist Dr. Jodi A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.